So I've been meaning to make this video for a while, since like February, because that's when I got my port placed. And I get questions a lot when I go out and when people recognize that it's a port, or even, sorry, I'm fixing my Fitbit. Or even when I'm in the hospital, I get questions about, I always get questions about why did I get a port. Ports are predominantly, from my understanding, used in cancer patients for chemo, because they have to get it so much and so often they can't keep getting repeat IVs put in, because it's going to ruin their veins, and then they're not going to have any veins left for chemo. Also, chemo is a very abrasive drug, so I don't know if regular veins could withstand chemo, but I don't know. Obviously, chemo and cancer is not my area of expertise, clearly. I got my port February 13th, and it looks like, well, I'll insert like a picture or something of how it looks, but this is what it looks like when it's accessed. And being accessed just means I've got a needle in there and an IV tubing line for medication administration. It generally looks like a bone under my skin. It's a raise in my skin. It looks anywhere from triangular to circular, depending on what way my arm is moved. And it's got these 3 little knobbies on it in a triangular pattern. And you find those 3 little knobs, and then you go dead center those, and then that's where you insert the catheter needle. And the port is in an artery directly to the heart, so it's fast, easy medication that I can get. I wouldn't say easy, but I mean, it's because of my cystic fibrosis. I've been in the hospital countless times, and my veins have been ruined. I mean, time and time again. They've always been kind of difficult, but especially since my Whipple surgery in 2016, where I had my pancreas taken out, they've gotten even more difficult. They roll, they dip, so when the needle goes in, they just kind of sink, so the needle, so the needle goes, so here's the vein, and the needle goes in, and then they start to go like this the further the needle goes in. They just hate needles. They also blow really easily and infiltrate, so then my vein is busted and there's free fluid in my arms of medication that should not be there, because the vein just couldn't handle all the medication. They've also sclerosed, which means they are significantly scarred over, and a lot of them are just solid scar tissue, and that just makes them almost impossible to access. So I got tired of getting like 4, 5, 6 pokes when I went to the ER trying to get an IV line started on me. They would have to dig. They would have to fish around with the needle, which hurts really bad. If you've ever had your blood drawn, you probably know what I'm talking about. There are fishers out there, and they probably shouldn't be in that business because they cause quite a bit of pain. And I would think quite a bit more damage by just waving a needle around and all that tissue under there. So I got my port placed February 13th, so I didn't have to get poked with needles anymore. Another reason was so I could do IV antibiotics at home. I have an IV pole that I can set antibiotics up on and then just lay in bed or sit on the couch and watch TV while it runs my antibiotic through. Because I'm at a point in this road that is cystic fibrosis where I am almost in constant need of antibiotics for one reason or another. That reason predominantly being my sinuses are so jacked up. There's still, regardless of having 6 sinus surgeries in my life, which is 6 more than anybody really should have, there's still a lot of infection up there, and I have MRSA up there, and that's never gonna go away. That's there to stay. It doesn't pay rent, but it's a squatter. I also have Pseudomonas, but I think it's more in my lungs than my sinuses, but my lungs have never been an issue, knock on wood. But my sinuses have been a consistent issue, and within the last year, they've gotten even worse. I have daily nosebleeds. I'm constantly congested. I can't breathe. A lot of times I can't smell or taste anything, which, if you know me, you know those are my 2 greatest, most favorite senses there are, is food and good smelly stuff like essential oils. And so my quality of life really deteriorates when I can't smell or taste. So I'm on an antibiotic right now called ceftriaxone. Yeah, ceftriaxone. I don't know if that's backwards or not. I think it is. But it's an IV medication, and the cool thing about this antibiotic is it's once a day, and it's just a push medication, so I just hook it up. Sorry. I just hook it up like that, and then I push the medication. I've already done my dose for the day, and actually this is my last dose. So I've already heparinized my line, which this is heparin, and I'm sure everybody's heard of heparin. It's a blood thinner, and you always want to flush the line with heparin before deaccessing, pulling the needle out, because it keeps the area around the port from forming a clot. Because if this got clotted off, I could no longer use it, and then I would potentially have to get it surgically removed. And I will tell you, putting it in was no treat. I was wildly uncomfortable. That's an understatement. It was extremely painful. You don't go to sleep for this surgery. You are partially awake. But the healing afterwards was pretty rough on me because I'm a thin person. So my skin really had to stretch to go over the port because it doesn't pop out as far as this needle is out, but it's there, kind of, if you can kind of see how it raises there. So that's what I got my port for, was antibiotics and IV access. So when I end up in the hospital, which has been a lot over the last 6 months, I don't have to worry about IV pokes. It is a needle going into the port, but it's a really quick stick. It's not a big needle. They know directly where they're going. It's very straightforward. I've even been learning how to do it. My nurse has been helping teach me. That way I can access it myself. Sorry. And do my monthly flushes myself. I'm not quite there yet. I'm still pretty nervous about doing it myself, but I have done it myself a couple times with my nurse's supervision, which has been really cool. So it's been, honestly, I tell everybody it's the best medical decision I've ever made. I don't really have any words for how helpful it has been, but it has been a world of difference. It's been a gift, a blessing, The other cool thing is, because when you have an IV line in your arm, if you have a particularly abrasive medication like Benadryl that's going through, it burns. It burns a lot. And the cool thing about the port is it's deep enough that I don't feel it. I don't feel the medication going in. So I don't feel the burn or the negative side effects of it being injected into me. It's just been a world of difference for me, and I kind of wish I got it done sooner, but now is better than later, I guess. So it's my buddy. I'm gonna keep it with me for as long as possible, hopefully until I'm 6 feet under, which I will not be 6 feet under, by the way. No, that's just, don't want to do that. I will be reincarnated as a reef. That has been my decision. I want to be, you know how you can have your ashes mixed and then you become a tree. Well, they also do, you can have your ashes, I don't know what they mix it with, but they put it in a reef, a coral reef. And then you eventually grow and you become a piece of coral, or a sponge, or a anemone. Probably not an anemone. I think you just become coral. That's my decision. But hopefully this puppy is going to stay with me until the very end. So if you have any questions, don't be afraid to ask. I have no problem answering. And actually, you know what? I'm gonna de-access it now so you guys can see. Well, you know, I won't do it on camera because I don't want you guys to like get grossed out by a needle coming out of the skin. But I'll be right back.